This is the most recent inspection report from the Virginia Department of Health for the Colonial Heights Rehabilitation and Nursing Center. Its date, August 6th of this year. That is just 2 months before Colonial Heights police received a complaint of possible elder abuse and neglect from Adult Protective Services regarding a 74-year-old resident at the facility who prosecutors say died from sepsis from wounds on her back and in her genital area. Prosecutors say the woman was left in her bed for days in her own urine and feces, and her wounds from the poor care were so bad, APS originally thought she might have been a victim of sexual assault. Now, during the August inspection, which happened because of 9 different complaints about the facility, the inspector reviewed the records of 23 out of 178 residents. They found one resident had a severe yeast rash on their buttocks. The inspector said the staff failed to provide incontinence care to meet the needs of the resident and noted the facility's nurses revealed no documentation of the rash prior to or even after a nurse practitioner pointed it out to them. The nurse practitioner wrote in her notes, "Patient has had this in the past, will be worse if she continues to lay in waste for hours." Instructed patient to advocate for herself by talking to the director of nursing regarding how long she is laying in waste. The inspector also noted staff failed to give a diabetes medication to one resident 3 Saturdays in a row, did not have self-catheterization supplies available to a resident, so he was uncomfortable after not being able to empty his urine since the morning prior, and staff failed to consult with a resident's doctor and resident representative and failed to implement its abuse policy after the resident, who was classified as having severe cognitive impairment, was found engaging in sexual activity with another resident on 2 occasions. Now, according to the policy, any suspected or witnessed incidents of patient-on-patient abuse or exploitation brought to the attention of the administration will result in an internal investigation and reporting to the state survey agency. Failure by an employee to report any witnessed incident of mistreatment, abuse, neglect, theft, or exploitation or reasonable suspected crime against a patient will result in corrective action.